She was born, Tina Lindemann has also had many, many years of experience in orgonomy. She was born and raised in the 1970s in West Berlin. She's also the chairwoman of the Wilhelm Reich Gesellschaft in Germany, which is she has 25 years of experience working on orgonomy, in particular focusing on the patients with physical medical diagnoses. She takes a very functional approach, as Reich defined it, working with the accumulator and with orgone blankets with her patients in combination with psychiatric body therapy. And she also networks practitioners who continue to work in this field and seeks to tie his innovations to mainstream medical practice. She has a private practice and works in multiple medical settings. And I thought the last that she was in Vienna these days, but she's originally, I know, from Berlin. So I'm not sure. I'm pretty sure she's still in Vienna, but she's great. And hopefully we can get her Zoom screen up. And some of you may be familiar with Heiko Lassig. I know she worked closely with him and knows many other people who work in Germany in orgonomy, much like Dr. Caboro. So that's just until we can get her up. I thought the man he mentioned, Gerald Pollack, asking if anybody knows him. I'm including his information, or trying to introduce some of his information in the talk today I'm giving later on. That was, because I assumed, having read his book, I thought he must know about orgonomy. There are too many references he made that I thought, so said that. Hey, Tina.
Hi, Connie. Nice to see you again. Hi. Hi, everybody. And thank you to Stefan for inviting me, and for Stefan and Connie for all the work, and great seeing you. To complicate it further, I'm living in Vienna. I'm born in Berlin, but at the moment I'm in northern Bavaria in the countryside, enjoying the rainy day, similar to Yorgos, and all the nature around. There was just a deer hopping by, so it's a great place. And also a great place to put an accumulator. I've got one in the rooftop of my barn here. I was asked to talk about two subjects, actually. And there's one I can probably do pretty quick, because the state of orgonomy in Europe would either take a conference with a lot of participating organizations and people from all over Europe, and a lot of translations, because what makes it difficult is the variety of languages. So you see there's Yorgos from Germany, and other people in Germany that I know better, and of course in Austria. And then there's Armando Vecchietti and Mr. Marione from yesterday from Italy. Then sometimes it's a bit difficult with me not speaking Italian and them probably not speaking German and meeting in English. But if we could share my very, very, very short PowerPoint presentation for a second. I will just show you a short impression of how many organizations and things I found easily, and there's many more that I didn't find so easily, and I couldn't by no means put all of them on PowerPoint folds, or I would bore you to death, probably, causing a lot of stagnation in your energy and mine. So to the organization, can I, freigeben, there it is. There it should be. Can you see?
Not yet. If you click share.
Do you see anything?
You have to click share.
I tried. Wait a minute. Click share again. Yes. You see? You see it?
Yeah, we're starting. Yes. Yes.
So I suppose I can send this at some point to Stefan, so you could share it if you're interested. But this is what you find easily on the internet about orgonomy in Europe. In the beginning, there is the German Wilhelm Reich Association, where I'm the chairwoman, which is by now quite a small group of about 25 people, most of them older than me. And They started with Heiko Lasek, my therapy teacher in orgone therapy. I will come to that later. And a lot of other people doing the Bion experiments by Wilhelm Reich in the beginning, mostly working with the accumulator, trying to do research about the accumulator. And also doing, they invited all the students of Reich who were still alive and had a strong connection with Eva Reich for a long time. And so this was where I was educated, and Heiko Lasek, who was a long-term chairman, was a medical doctor and also taught me the therapy that I do that is focusing on the medically focused therapy. So orgone therapy with patients with cancer, with high blood pressure and all, a bit similar to what Yorgos does, but with a focus on the body therapy, energetic therapy, and the use of the accumulator. I talked about my therapy and the method in a longer talk at the conference at Orgonon in 2022, and the video is still available on the website of the museum. So I won't go into detail in that terms because 45 minutes for 2 themes is enough. But yes, that's the German association, mostly providing information to people who contact us and helping with addresses of therapists and helping probably with what I will talk in the second part about. Then there's very similar, the Austrian Association, located in Vienna. And if you go through that list further, you will see there's different organizations focusing on different parts of Reich's legacy. So some deal more with therapy for parents and babies with complicated births and pregnancies, trauma, birth trauma, connected strongly with Eva Reich again. Then there is a huge organization, the EABP, which is an organization for body psychotherapy in Europe. And they have local organizations in almost every European country. In Germany, it's DGK. You can see, can you see my? Yeah, which is here. But there's also an Austrian, a French, an Irish, whatever branch, and many of the organized body psychotherapists have their roots in Wilhelm Reich connected therapies. This is the second part, besides the language is making it complicated, that there are so many different branches from Gestalt to biosynthesis to functionalism to that make it difficult to say there is one orgonomy in Europe. There's plenty of orgonomies in Europe, plenty of people and organizations working with for research, for the sociology or historical part of doing research in Reich, for medical or oncological research, but they're all widely spread. So most of them know each other somehow, but are not necessarily connected. Some don't even know that the other ones exist. So this is what I said. I can make it short because it's too big to speak about it in such short time. And on the other hand, it's too widely spread to do them all justice. The second page shows more. How do I do that? People who know me know that I rarely ever do, this works, PowerPoint. Usually I just talk or do it the old-fashioned way. So there you see, it's also Italy, Greece, Belgium, France, and there are some countries like Bulgaria, Romania. I couldn't even get into it because I don't get the Google results when I can't read. I mean, I can read them, but I don't understand them. And to get to the final point in that theme, because it is too big, is this. I think there's people following up Reich's legacy and Reich's questions, because I think he, in some realms, left us more questions than results, which is good because the questions were what always brought him on. But there's more questions, and there's so many different organizations dealing with all those questions in so different ways, and probably in different opinions about all kinds of things like politics and what you should do and what you shouldn't do, that having one worldwide or European organization would make it really, really difficult. But I think it would be worth it to have, it's a long time idea of mine, to have like an online calendar, and I'm technically not the right person to put that into reality, but a calendar where everybody who's doing anything regarding Reich could just put the date, the title, and a connecting email for getting more information online, without an option for comments, for deciding who's good and who's bad, so that everybody can at least see how many things are going on there. Because whenever I talked with people about their work and their feeling about being someone who's dealing with something unusual in comparison to the mainstream, be it medicine or history or all kind of biology or therapy, or it would be just so relieving to know that you're not alone, that there's people in Brazil and Mexico, that there's people in all kinds of parts of Europe, in Australia, in Japan, in more parts of Asia. As I saw, I couldn't stay up so long, but as I see in Iran, and I find that fantastic. And I think we should think about a way to at least spread the information without doing the huge amount of work that it would mean to censor who's in and who's out. People can hopefully think for themselves in some way. Maybe there's someone in the audience or listening from abroad who thinks like, oh, that's easy to make a calendar where you can just apply for access and then be able to just enter a date and a title and an email and a web page or something where people could just see, oh, there's something tomorrow and there's 3 things next weekend, to give us the feeling that we're not so alone and so special as we always tend to feel. End of message here. So you see, there's all kinds of ways people follow up with Reich everywhere in Europe, and that would be quite another conference to bring them all together, and would need a lot of planning and translating and things. But it's by no means dead. It's sometimes difficult finding young people, but on the other hand, since I'm the contact address for the German Association, I get requests regarding the accumulator, regarding books, regarding education, training, therapy training, which is rare at the moment, all the time. So whenever some young students mostly, or just people who find a book in their parents' bookshelf, start reading Reich, they contact and they ask questions. And this is one reason why I think that also it's important that our small association is kept alive, and would be so easy to say like, okay, there should be someone else, or we've not doing big conferences or congresses in the last few years because it's too much work for so few people. But it's still good that we're there and that we are existing, and everybody else in Europe and in the world. And I agree very much with Yorgos that Reich's ideas and approach to life itself is one of the very important things for our future if we want to have one. Even if however. What I don't like, and I want to at least mention it, this is why there's the but down there, is there's also a lot of business made on the internet with things using the term orgone without knowing something about it or without really being connected. As I write there, there's Orgone hair water for making your hair grow again. And all kinds of things built that might have some function. I never had an orgonite in my hand that gave me the feeling that there's something going on, but that's my feeling, my opinion. And I'm not the person to judge about everything, but as long as it has nothing to do with Reich's findings and the functioning principle of the organ accumulator or the doorbuster or everything, I think at least there's a lot of research to be done to see if it really has something to do with it or what it is, or maybe find your own name and your own term and make your advertisement without using one which is controversial enough to be connected with, especially as a medical doctor, for example. But it's difficult enough to be connected with Reich and Orgone in itself, then that we have to deal with all kinds of things that try to, yeah, as a blind passenger, drive by and make some money off it. This would also be something further to discuss or maybe just ignore. My teacher used to say, "Oh, don't react. They disqualify themselves. Is time coming?" So I don't, but I just wanted to mention, because this is also when you try to check the internet for Orgone and Wilhelm Reich in Europe, at least, probably the same at your place, you find a lot of things that distract you from the real thing. And yes, I suppose, I can't see it from here. Can you still see me, or do you just hear my voice and see the?
We
We see you too.
Okay.
Oh,
You're
all right.
small on the.
Okay, I have no idea if I can change that, but for the end, but I'm not still finished, there would be a last thing, but maybe we can share it again then, and I'll switch it off now and share it later again. Hi, I'm back. What interests me more, or what made me think more what I would tell you, was the second question about research regarding the orgone accumulator. And I could, of course, go back into history and tell you about trials to find temperature differences, which is actually the first research with an orgone accumulator I ever came across with when I was about 5 years old or something, when my father tried to measure temperature in an orgone box he built himself in Berlin. And it wasn't quite so easy because temperature measurement is much more difficult than you would think. A lorry or a van driving by in the street outside could already make the temperature changing and then changing back in the accumulator. So, and there were other trials later on that I read of and heard of and met people who tried, and they had all kinds of different results. Many of them showing the exact temperature difference that Reich showed too, but not all. And me as a medical doctor always wanted to see the differences in people. And I was for a long time thinking about how to do research with the accumulator after all the good results I had with my patients over time. Maybe we find time for some case histories later on, but there was always the difficulty that it's not very pleasant to measure core temperature for someone sitting in a device. Or how exactly do you do that? And how do you put people in a measurement situation beforehand and then put them in the accumulator and then out again? And how do you compare? So temperature didn't really work out for me as a research idea. And then after a few years of, I would say about 10, 15 years ago, the first time I heard about heart rate variability. I don't know if you know what that is. everybody knows he's got a pulse. Your heart is beating, and somewhere between 60 and 80 beats per minute are quite fine when you're okay and healthy. Very sportive people who train a lot may have a lower heart rate. Some people have a faster heart rate, and when you start exercising, your heart rate goes up. That's what everybody knows. Maybe some people of you have a cardiologist who's already using it. Maybe you came across in psychiatric research somewhere, because heart rate variability doesn't say your heart rate is changing. It says if you have a pulse of 80 per minute, your heart rate is somewhere between probably 76 and 84. And the way it goes around that medium 80 per minute can be very different. It can be very narrow and very flat. It can be very chaotic. It can be very coherent in a nice wave. And this wave movement is something we all know from Reich. Life is pulsation. So our heart not only pulsates to pump blood, but also the way it pulsates around this medium heart frequency that we show at a certain moment. And what was better, on one hand, better sensors to measure that easier, like on the earlobe or something. On the other hand, was better computers. Researchers found that if your heart rate pulsates in a coherent way, that relates to better outcome in healing of diseases, better self-regulation, longer life expectancy. And this is all connected very, very closely to the vegetative nerve system, of course, because the vegetative nerve system is what regulates your heart rate. So when I heard about that the first time, there was a very easy to access like biofeedback device. You could put a clip in your ear and have a little box as big as an MP3 player or something. And it showed you a red, a yellow, and a green light. So you could put that thing on your ear and breathe and relax and see that your heart rate variability, coherence was getting better when your light switched from red to yellow to green. And you could also modify the sensitivity of this little machine. So you could, in a way, train to relax, because when you relax into parasympathetic state of your vegetative nerve system, the coherence of the heart tends to get better. And I found that interesting, because getting into more relaxation in a more parasympathetic pulsation of the vegetative nerve system was always a result, and by that a goal of, on one hand, the body therapy that I do, was people breathing, maybe getting into action and then into a very deep state of relaxation where healing and self-regulation started taking place. And also the same effect resulted when people who needed it were using the Orgone blankets that I make myself or the accumulator that I have in my praxis. So I wondered if this little red, yellow, green light, traffic light like device would show an effect in the accumulator with people who don't know what I'm doing, so that they don't try or something, just using it like normal. And I found that yes, more often than not, it has that effect. But by that time, like 10, 12 years ago, at least I didn't know about a device that I could afford. And that would easily give me the option to save the results and to compare the results and to do something with it. So I found like, okay, Orgone accumulator shows an effect, obviously, on this heart rate variability, but And I was always thinking that would be something to do a study with more clients, with people who don't know an accumulator, who was healthy people in the beginning, or maybe also with people with high blood pressure or something. But at that time, it wasn't easy. And then the pandemics came around and stopped all kinds of plans and things and brought back necessities. But I was thinking about it, and the machines, the options for researchers to do that and to be able, I mean, the prices went down, and at the same time, the computers were getting better, like with everything. So by the end of the pandemic, I thought like, okay, maybe now I could start trying that. And I always had the plan to do the big thing, a big double-blind experiment with maybe 100 patients. And I got some professor from the Medical University of Vienna to give me feedback for my plans and to tell me what he thinks, like what kind of study design would make sense and stuff. And it still stayed pretty big, pretty complicated, and pretty long term. And that kind of hindered me. This gets together with, we should not only know about Reich and how we function or how energy functions, but we should always have a look at how does it function in ourselves and how do we react to things. And to me, this big project was certainly too big, especially to do it all alone, because there were not too many people in Vienna or in my group who said like, okay, we'll invest a lot of time and come to Vienna and do that. So I kept postponing it, thinking about it, having the plan ready in my head. And a colleague of mine always said like, let's do an education, let's do a therapy training. And she, sadly, she died in December. And I have no idea if it's a leftover from her telling me and finally do what you always wanted to do, or why something changed in my thinking. But by now, I switched from doing one big study to the actually more logical way of, first of all, do it in two parts. So what I'm planning now for hopefully this year and the beginning of next year is the first part of the big project, so to say. I will do a test row with fewer clients and not double-blinded, measuring heart rate variability in the orgone accumulator and outside, just to see if the results are promising enough to invest all the money and all the time. That a bigger double-blind second part will take. And that's in the actual planning at the moment. So about 10, maybe 15 people will get a little clip on the ear, will be measured before sitting in the accumulator, and then we'll go into the accumulator and will be measured again. And maybe one time the whole process, maybe two times, maybe also trying out an orgone blanket. We'll see how time and resources allow. And see if what I propose, my thesis, that the heart rate variability goes into the direction of more coherence, so more harmony in this swinging, going towards parasympathetic impulses in the nerve system. And if that works out, I plan to spend the time and the money and everything for the second part, which then would be with two devices like the accumulator and an visually identical box, blinded box that is not an accumulator, which is one of the tricky parts, how to build a blind accumulator that looks the same. I can't have a metal layer inside that is visible because I won't be able to have a similar looking metal inside or an exact same looking similar inside, which is not metal, because as soon as it's metal, it's an accumulator. I'm working on that, and I do have ideas. I won't bother with you with the details. But this is what I think really is necessary, to have research done with the basics that we do have, to show that there is a physiological effect. And the beautiful thing about the heart rate variability, ARCH-IV, I should use the short term, the ARCH-IV, the beautiful thing is that absolutely independently from Reich and all kinds of energetical ideas about life energy and things that the mainstream might think is weird, strange, and esoteric, science already did the basic work. So heart rate variability is well researched. My cardiologist, to my surprise, used it to see if I have stress or not with a much more sophisticated machine for probably about 30,000 euros. And I was just surprised because she's really using it to tell me how I feel. A cardiologist, I never approached someone like that. But it arrived in general medicine. It's used in all kinds of research. It's used in diagnosis. It's also used in biofeedback therapy. So why shouldn't we, for once, use that the mainstream research has done the work for us and only do the little tip on the iceberg or the cherry on the ice cream, to get results that support Wilhelm Reich's theories and make us able then, when the results are good, to finally start discussing, not discussing, but maybe using the accumulator openly and publicly and legally allowed in the medical system. Because by now, I use the accumulator with patients for 25 years with very good results, with almost always only very good results. I can agree with Yorgos. I don't use the doorbuster so much because I really feel the draw of the energy and the movement, and it also moves mine. So, and I didn't automize it. So, what I do use is the combination of the accumulator and the blanket, if indicated, in combination with the body therapy, with breathing, also for discharge, for opening up blockages gently, and then also charging, because as we all know that the traditional normal cancer patient needs charging and enhancing his capacity for life energy. And not only with the accumulator, which is fine. I just started working or helping a father of a friend who has the diagnosis of pancreatic cancer. And he never had any contact with Reich or anything like that. But my friend gave him the Orgone blanket that I made for her once. And he's so fond of it by now that he's really curious to use an accumulator because she told him about it. So we just organize that. And my experiences are so extremely well, as long as you take measures to see that on one hand you don't treat someone with contraindications, except, like Yorgos said, when you take measures to not have an overcharge or not have the disintegration of a too big tumor or have swelling in certain areas, like with brain tumors or something. There's no reason why that shouldn't be used, widely spread with informed therapists and doctors around. And whenever anybody has questions regarding therapy with someone, feel free to contact me. Yeah, and I think we do need the research, and this is why I'm planning to do the research in a way that doesn't show that the accumulator is healing anybody, because that would be what probably would cause people to really have a stronger look at what I've done in the last 20 years and maybe do controls, but to show that there's a positive physiological effect on the vegetative nerve system, like you could even say it's wellness or it's prevention, like Reich proposed, that you rather prevent disease instead of healing them because it's much easier to prevent it. But if you have an accumulator and you sit in there, and like a yoga teacher who tried it the first time once told me, like, this is instant meditation because he fell into a meditative state easily because he was trained, but he fell into it in the accumulator while being curious and just trying it out at a meeting. If you could just make people start using it without being afraid that somebody says like it's not doing anything and it can't do anything, that would be one step in the right direction, I think. Connie, what's the time and how much time do I have? I lost track because
Yeah, I know. So,
I started later and
5 minutes, maybe 10. And
all right.
because he's and I actually had a question, Tina.
Yes, please.
with-
Yeah.
Just, I wanted to know what varieties of cancer you've treated. And maybe if you knew a little bit, could remember even like the different stages possibly. And if you've ever, well, yeah, that would be my first question. Yeah.
Okay. So one of the first cancer patients I treated in Vienna was actually a medical doctor with cervical cancer who already had chemotherapy and radiation therapy beforehand, before I even met her, and she had then surgery and in a PET scan to lymph nodes with proposed metastasis. So her prognosis by school medicine was maximum 2 years, rather less. We started working pretty intensely with body therapy, and she got an orgone blanket from me and an accumulator for at home. And she started using it. And does anybody say something, or is this an echo?
It's an echo.
Okay.
Go ahead.
So she started using the accumulator. The most work we did on the emotional body therapy part was having her as a doctor accept that even if statistics says that she's gonna die, she is allowed to stay on one hand, which was difficult, and to make her listen to her body, because whenever, as a doctor, usually whenever she had a fever or something, she took a pill and went to work, because how can you leave your colleagues alone? And it was really hard getting her to say that she's more important than than whatever anybody thinks of her. And we had a pretty intense phase, and this is by now, I moved to Vienna in 2006. It's 19 years ago. She's well and kicking and working and very happy. So nothing ever happened, and she had to accept that statistics is not killing her. I had 2 cases of pancreatic cancer. One came very, very late with a lot of metastasis, a huge tumor, and a really, really little acceptance for that there's might be some reason in the way he deals with his energy and his emotions. But he still used the accumulator and the orgone blanket, and he had quite a long remission where the tumor was still there, the metastasis was still there, but didn't move much. And had time to order his things. He had a great relationship at the time again, but still at some point about, I think it was about a year later, also when he already should have been gone, he suddenly started to get worse, and then had a very, very short and not very painful phase. And then he died pretty quickly. The other one was a younger woman, a psychotherapist, with a lot of trauma in her history and caring for everybody else, but not for herself much. And she came to see me. She had an inoperable cancer of the head of the pancreas, She was in chemotherapy, not coping very well, a lot of sickness, a lot of tiredness, fatigue, headaches, all kinds of things. She started using the accumulator and therapy intensely after the second cycle of chemotherapy and started to not lose her hair, not being sick anymore, not being tired anymore. And after the finish of the chemotherapy and the tests after 2 months, the doctors had to tell her that there's no tumor left and that that this is unusual. And then the bad thing they said was, but you don't expect being healed, because the doctor couldn't stand that she could be different from everybody else that he lost with pancreatic cancer. So we had to do a lot of emotional work, that she started getting angry on the doctor instead of being afraid of dying without any tumor left. And she was getting better and better. And then with the next control, there was still no tumor, but they started telling her about this last little cell that could be there and that they should do radiation because maybe there is this one cell. And then she was afraid again, and she started radiation. And of course, she had to stop using the accumulator because radiation and accumulator use, as we all know from Orgone experiments, doesn't go well together. And we even had to move her therapy sessions from the room where the accumulator was to a different place because she couldn't stand the atmosphere in the same room with the accumulator during the radiation treatment. And then a phase started where medical treatment in the hospital with surgery, with side effects of radiation, with infections, with mistreat, with antibiotics she couldn't stand, with all kinds of things, ended up in her being in a constant struggle to survive the treatments in the hospital and trying to become able to get back to herself and to her emotions again. And at the point where she decided, okay, we might try to fight the doctors. There was really maltreatment. She died of a side effect. There was never another tumor, and in between they tried to tell her that maybe it wasn't even pancreatic cancer. I mean, I saw the pictures and the results. There wasn't even pancreatic cancer. Maybe it was something completely different from the beginning, and that's maybe why she's so sick. So I didn't lose her to the pancreatic cancer. I lost her to the hospital
Radiation.
and to
Yeah.
other people. Yeah. But this is one story, and this is why I think, yes, I never tell someone, and I'm not allowed to tell someone not to do the treatment. And with chemotherapy, they changed a lot over the last 10, 15 years, and they're getting better and easier to take and more specific and stuff. And also radiation therapy is getting more specific with lower doses and everything. But whenever someone asks me what would I do if I had a cancer, I might be tempted to use a chemotherapy just to get the tumor smaller, so that when the accumulator helps me to dissolve it at some point, my kidneys don't suffer too much. But I would never ever do radiation myself. I'm pretty sure about that, because it would stop me from using what I think is the most helpful thing that I can use, which is the accumulator, and a good therapist who's there when you start getting emotional, when you, like Reich said, he never seen a cancer patient with loud emotions. They don't anger, they don't rage, they don't get loud and cry and whatever. They are a tiny bit disappointed, and they're a little bit angry, and they're, yeah, it's sad, melancholic and stuff. But when you charge up a cancer patient enough with an accumulator and with body therapy, they start getting those emotions, and then they need someone who's there and can stand that they get angry and that they get loud and then they get frustrated and they don't love their life and they want to change it, and they're so afraid of changing it because then they wouldn't be loved anymore. This is what I do in the therapy part, in the body therapy part. So
I have two more questions also. I'm
yes,
assuming you have other things to tell us, but I know I have two other people who want to ask a question.
sure.
What kind of psychiatric diseases have you treated successfully?
What kind of
I do
diseases.
have very good experiences with depressions because at least in my experience with the few really depressive patients that I had, getting getting the energy moved, charge up a little bit, but get the energy moved and be there when they start expressing the fear mostly that they have. Because to me, depression, I mean, tell me if I'm wrong, I'm not a psychiatrist, I'm a medical doctor, but whenever they start to, you start to move the energy and you charge them up a little bit and you allow that to come out and be there and keep the contact going while they even may be unpleasant or something, they and they get a contact with the emotion that they can't have, that they're too afraid of, or that are too dangerous, the depression isn't necessary anymore. I mean, maybe with a clinic depression, those emotions are very, very deeply buried and probably in the beginning of the history of the person or an early trauma or something. But I know that whenever I get in that direction, always with patients that are depressive, whenever they start expressing their emotions and the energy, the orgone starts to move in the body, the depression isn't the point anymore. To me, it's it's trying to either not be angry or not be sad or not be afraid, and you can't lock out only one emotion. So whenever you try to get rid of one emotion, you stop all of them in a way. And then not having any emotions, to me, it's depression. Everything's gray, no hope, no movement, no nothing. So getting to one of those emotions and start really feeling them, not only thinking them and talking about them, but feeling them in your body and stand that it's a very intense physical feeling, opens the door, and then they start coming out one after the other. And that can be frightening for the patient and sometimes even for the therapist, because that can be intense, and it's loud. In my practice, I often have it that the therapists in the other room said like, "Oh my God, what was that? I had to explain to my patient that nobody's suffering there, but what was that?" And I said, like, somebody was angry. He was screaming and he was crying loudly and he was complaining loudly or whatever. I need a space to work where people can be loud without being shy about it, without being feeling somebody's listening and somebody doesn't like it, or I'm scaring someone, whatever was in their history that it's not easy in a bigger city with old houses with small walls,
Yeah.
but yeah. So, and the other
Yeah.
thing is fears. There's often fears behind physical symptoms, but also fear in itself, and how to be as so to be courageous, to have your fears is one of the main themes. What I don't do is working with people with psychosis, with active psychosis, because getting energy moving in your body and getting a more intense feeling of your bodies, and in a way, first of all, dissolving some of the blockages can intensify the psychosis. And I have to have clients who are willing and responsible for dealing with their feelings and effects of the therapy themselves. And I think for someone with a psychosis, and can be really too much. I had clients with the diagnosis of schizophrenic or schizoid character disorders or something from a psychiatrist in Vienna, and I had good experience with it, even if I wouldn't say that somebody's without nothing ever happened or something in the end, but certainly getting more contact with himself and more assuredness about that what he feels is okay. And yeah, that's mostly it. And life crisis of all kinds, divorces, separations, death of relatives or friends. Yeah.